That's what we're doing in this incredible profession through our service in public health. So it is our job to say that we are public health professionals. Public health is the voice of conscience in the rat race of healthcare, because as the saying goes, when you win the rat race, you're still a rat. That public health affects every life and every day of every life. That public health adds years to our lives and quality of life to all of our years. That public health means transforming our current emphasis on sick care, focused on treatment, often delivered late, to a true public health system that delivers prevention as early as possible. In short, what the Johns Hopkins School of Public Health likes to say, public health is saving lives, millions at a time. That's what we do in public health. And we are proud of service, because ultimately public health is science in the service to society. And we do this in terms of service and dedicating ourselves to building stronger communities. There's a line in Healthy People 2010 that I absolutely love, and it reads, quote, "The health of the individual is almost inseparable from the health of the greater community," unquote. In short, the social determinants matter, and we are all interdependent, and we are all interconnected. How appropriate that this meeting here is in Philadelphia, where over 200 years ago, the US Constitution started off with the goal of, quote, "We the people to form a more perfect union." That is our goal in public health. And I'm a Massachusetts guy, so I'm very partial to former President Kennedy and the late Senator Kennedy, who touched my life very personally. President John F. Kennedy wrote almost 45 years ago, quote, "And if we cannot end now our differences, at least we can help make the world safe for diversity. From the final analysis, our most common basic link is that we all inhabit this small planet. We all breathe the same air. We all cherish our children's future, and we are all mortal." That's what it's all about. So if we dedicate ourselves to mission and service and community and public health, we can work closely with the leaders and the members of APHA in accomplishing its three overarching priorities: rebuilding the public health infrastructure, ensuring access to health care, and eliminating health disparities. In the last few minutes of my presentation, let me just comment about how the new administration is working with you to advance those three overarching priorities. First, with respect to rebuilding the public health infrastructure, we have a president and secretary that's talking about health, prevention, and wellness just about every day in the news, and it is great to see, isn't it? Thank you. You know that one of the president's first acts was to sign the Children's Health Insurance Program Reauthorization Act, funded primarily by an increase in the federal excise tax on tobacco. Thank you. And we are very proud of that effort, both with respect to insurance coverage for kids and for tobacco control. We know the President and Congress has put an unprecedented $1 billion in prevention and wellness in the ARA Act, American Recovery and Reinvestment Act, and $650 million of that $1 billion into the communities putting prevention to work that deals specifically with obesity control and tobacco control. So we are thrilled and honored to be part of that commitment to prevention at the community level. And I must comment that my very first day on the job was June 22nd, 2009, and on that day, I was in the Rose Garden, observing as the President signed the Family Smoking Prevention and Tobacco Control Act into law, creating a new FDA Center for Tobacco Products that will oversee the science-based regulation of tobacco products for the first time anywhere in the world. Thank you. Thank you.